start by appreciating the leadership of the convention and this church. It's an honor to be called here. Thank you so much. God bless you, more grace for the work ahead. Thank you so much for having me here. I will try as much as possible to make it less medical to come back home so that we can relate well with what I have to say. So, and then the session is going to be 2 sessions. I'm going to try and enlighten us about substance abuse, and then there will be session for interactive session in which please you can ask any question. I will answer to the best of my knowledge. If there is anyone that we can't answer, we'll get it across to you back. Where I work is youth, so there is always hierarchy. We have consultants, we have professors, and all. So nobody's an island of knowledge. So, but we'll do the best we can for today or tonight. Thank you so much for having me. So I have my slide presentation. I don't know if it's been projected. Just so that I can capture if not everybody, as much as possible. I would like to capture everybody's attention, please. All right, so while we're waiting for the slide projection, so I'm talking about substance abuse. Substance abuse is something that is not strange. I'm very sure everybody must have heard at one point, you understand? It's a common knowledge among you understand? So a lot of stigmatization and a lot, but it's a mental health burden. It's the rate at which it's increasing, the body is increasing, is on a daily, it's rising like an opera, and which is why I was so happy when I was invited to talk about substance abuse, because we need to talk more about it. We need to enlighten people. Even when we get to the point, I'll talk about the prevention, we still start with the education, health education on substance abuse. So substance abuse is any drug taken without prescription, or we introduce it as I define it as excessive use of a drug in a way that is detrimental to the self, the society, or both. So in the context of substance abuse that we're talking about, I will still mention the different substance of abuse. I have it in my slide, which will soon be projected and can be made available to the brethren as leadership will decide. All right, so we talk about, when we're talking about substance abuse, we are looking at addiction, abuse, and dependence. So we are looking at 4 C's. There is compulsion, and there is control of cravings, and then consequence. So compulsion, there is irresistible urge, which I will define very well. So when you see somebody taking substance of abuse, why would this person work from morning till night? Will not even mind eating. Before thinking of, I want to buy fufu or buy rice, the person is thinking of taking substance. Is it that the person cannot think of something? You understand? Somebody keeps taking substance, keeps smoking, keeps taking smoking cigarette, keeps taking cannabis, keeps taking loud, you understand, Arizona and the likes of it, or keep drinking alcohol, and despite the person is aware of it, because there is something ongoing. There is a strong desire, an irresistible one that the person cannot control it. Because once anybody starts the substance of abuse, it's quite addictive. So that's why you see, he's addicted. You understand? Don't worry, the person is an abuser. You understand? So there is this compulsion to take the drug, and then they can't control the level of use. You're like, I'm not taking it again, I just want to take a bottle of alcohol. And then you find out the person end up taking more than they plan to. I'll just take a stick of cigarettes, and before the end of the day, the person has taken 10, some to the point of 20 sticks. And over the course of this lecture, I'll talk about the consequences, because you go during your clinical posting. I'm more focused on mental health, but during clinical posting in school, in medical posting, you see people that have done so well in their career, and then they come down. Okay. So the person has done so well. Yorùbá máa ní ó ti ṣe dáadáa, ó yẹ kó jẹun, iṣẹ́ tó ti ṣe, like you are supposed to retire and be enjoying your grandkids, enjoy your retirement, doing all traveling around, and the person is battling, and then you ask, because in school you have to take history. From history, that's when you now ask history of substance use, and you find out that the person has been probably smoking 20 sticks in a day for over 20 years. That's significant. So the lungs will start getting damaged small, 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 and then when the person is supposed to be fine and all, the person is using all the money to do MRIs, CT scan, and doing chemotherapy, which is not only expensive but painful, stressing, and even the prognosis is bad. You understand? There's nothing God cannot do, but we too, should what? We should try and not to provoke the Holy Spirit. Don't provoke God. So this is the essence why it is important. And thank God for the churches nowadays, they are trying to enlighten us so that we make better choices. If can be avoided, let's avoid it. If somebody peradventure have started, you can take a U-turn. I pray the Lord will help us in Jesus' name. Okay. So while still waiting for the slide, so substance abuse is not just because the person is taking substance, is not responsible and all. It's because of the sequel of the consequence it causes. I've talked about the physical health, in which the person can have, in fact, it can manifest in so many things. It increases cardiovascular risk, if the person can have heart issues. Trying to make it as the person can have heart issues, have lung issues, any aspect. And the most important one is the brain. The damage to the brain, little by little. I had a 21-year-old male that was reviewing, there's already having atrophy of the brain. This is something that should be expected when someone is above 60-year-old. Do you understand? In fact, some people at 70, their brain mass is still the same, but you're wondering what exactly is going on. And unfortunately, the person is already having symptoms. The person is already, it's the part of the hospital part of the brain which controls, which is around where the visual field is, and then the person is already having issue with the sight. So it is important to learn, to know about substance abuse so that we can make informed decisions, because everyone will still have to take their decision and be responsible for it. So moving on, I classify, okay, I'm on classification slide, we can keep scrolling. All right, so I classify the substance of abuse. So I use the ICD-10, which is the International Classification of Diseases. There's a way they classify the substance of abuse. So we have the alcohol, the top on the list, which is the most abused drug. And alcohol top the list because it's a gateway medication, gateway drug. And what we mean about gateway is that some drugs will predispose an individual to take other substances. So somebody that abuses alcohol has the tendency of smoking cigarettes and also using cannabis and every other substance of abuse. So we have the opioids, which is also very significant and not popular. But we need to educate. Maybe I will even dwell on that. So the people that abuse opioid the most are people that suffer from chronic pains. Opioid are like a class of medication that helps with pain. They are mostly analgesic. So people that suffer from chronic pain, example, an individual living with sickle cell disease, what you call sickler, but we try not to tag the A's. We don't use that word because it's derogatory. So people with HBSS or sickle cell disease, they are constantly, because of the vaso-occlusive crisis, they are always in pain. Because of the pain, the pain is described as very excruciating. If you ask your patient, give me a score over 10, they tell you 10. If there is 10 over 10, if there is a score higher than 10, they will probably tell you. In fact, at that time, you find some of them will even try to commit suicide to tell you how excruciating the pain is. But one of the opioids that works for their pain is what they call pentasocin. Pentasocin is also a common drug of abuse nowadays, in which even the parents watching the child in pain, they tend to quickly just go and get a nurse and give pentasocin, and that causes a lot of havoc. it increases they get addicted to the pentazocine, that even when the pain is not there, it seems as if they are having the pain, the crave continues, and then the compulsion, because they have this irresistible urge to take the substance of abuse, and of course the sequel of it, the complication of it, they start having ulcers of wound ulcer of the injection sites. Then over time they find all those places, they become contractual. As it becomes stiff, you see people walking. I have what's it called? He's even an health practitioner from pentazocine addiction. Is a spot diagnosis. Once you see somebody having complication of pentazocine addiction, you know. You don't need somebody to tell you. An informed medical person knows. The person walks like this. The hand cannot come down. So when they want to sit inside the what's it called, any vehicle at all, there's a position they assume. Because the usual way, it's a blessing to be able to flex and extend your limbs, either the upper or lower limbs. This that will do. Thank you so much. So all this movement that we do, that we feel is just normal, waving and all that, you understand? You find that the person cannot, because of consistent injection, you find that wherever they inject the substance of abuse, especially pentazocine, you start having ulcers in those areas, and those ulcers, they don't usually heal. You will have to start inviting the orthopedics and so many other things. And despite evidence of the harm, the sad part of it is that the urge to continue is so strong that they continue. I saw a 15-year-old earlier this week when I was asked to come and review from the pediatrics team. And we found out that they were giving her on the Botox. And then that place was so sore, it was so stiff. And then the needle cannot enter. Imagine, the needle cannot enter the flesh. And so they had to move on, and then they continue to give her all the time. Because the way the pain will mimic, it will be as if it's an actual pain, but the mind, the body, there's a way the brain is craving it, because there's some neurotransmitter in the brain that's been tampered with. So it gives us a false signal that there is a pain, and then it continues like a vicious cycle. And then the person keeps craving the substance of abuse, and they keep taking it, and then the damage keeps continuing. So we bring such individuals to rehabilitation, we do a detoxification therapy for them, and then we do serious psychotherapy, which is in session. And of course, they'll be accountable and so many other things that we do. But the best of it, which I will still conclude with, is that prevention is always easier, cheaper, and better than cure. It's always better not to start it. And like I said, if anyone has started it, or you know anywhere, it's not the end of the road. One can protect it, we can stop and make a change. And God being our side, we will fight it and win. So moving on, the other substance of abuse are cannabis, which is now very rampant, different brand. When I started my residency, I had to go and learn so that I can know. You have to, when you are in Rome, behave like Rome. We are of the world, we are not of the world, but we're in this world. So we have to learn so that you're able to come to terms with your patient and know what exactly they are doing, what's the constituents of it, and how to help them. So you see them, they take loud, Arizona. I don't want to spoil our mind, but those things that, if by the time you want to cancel, so when somebody tells you they are taking Colorado, it is not coke, it is not, you understand, so you know that it should ring a bell. The person needs help, and find the nearest person that you can link the person in so that the person needs help. Alright, so other substances of abuse still on my classification. We have the benzodiazepine, the sedatives, the cocaine, other stimulants, hallucinogens, tobacco, that's the cigarettes, and any other substance can be abused. People abuse promethazine as well, they take it with pentazocine. So, it shows, okay, they're actually faster than me, which is fine. Alright, so I have pictures just showing the same substance of abuse according to the percentage in which the occurrence in which it is more dominant in our world. So the signs that you will see, because we have to know to be able to help, because of recent, we just finished, before coming here today, we just finished a family therapy with a family, and it's actually important. So we feel that it's not my life, I have So those that we need this information so that we can, in what's it called, in in our heart of compassion, so that we can counsel and help an individual that we feel is already on the path. So we, because it causes a lot of consequence on the family, the patient, the person were actually psychoeducated, the family are very noble family, distraughted about what is happening, but we say nobody likes to come to psychiatric hospital, but we don't look for our patients. Funny enough, they come and find us. Because when the symptoms come, it's not something that you can hide. Even if you try to dissociate yourself with somebody, they will call you. We had a patient recently that they were even looking for her and all that, but by the time they started picking, people started seeing her on the street, they will call, do you know this? Yeah, that your brother, that your uncle, that your friend, you understand? Even if you want to ignore, you will still have to, because the manifestation is not something to write home about. So it is always better for us to know about it so that we can prevent and know what to do. So the symptoms, I have top 6 signs of people using drug of abuse. One thing you will know is that the person withdraws, there's just a drastic change in them. They neglect personal hygiene. You find the person, you find a somewhere that is usually neat, that irons the clothes and is well dressed before going anywhere. The person could not really care. And not because they don't really care, but they are preoccupied. Everything they are thinking about is the substance. I need to take, let me just, even if they are working, let's just do, at all. It's about baloney. Like if you see people in transport and all those things, transportation, you see people spend their school fees, add earn money. They will even be aware that the parent probably took a loan and all that. They will spend it. And this is so paramount that it cuts across all economic group, both rich, middle, poor. It cuts across a lot. It's not a respecter of any social group at social economic group at all. So the person does everything and cannot even remember if you clean their house or take care of their hair or add their bed. They are just, as they're waking up in the morning, they want to take it as an eye opener. They need it to function. You'll be hearing that when I take it, it just calms me down. I'm able to process everything. I'll just understand. And then before they sleep, you hear that I cannot even sleep after. I need to sleep without it. And the thing that I want us to know is that they don't just start at that. Each of them had this, they were once without any issue of an abuse. They are ones with bright future, bright plan and all that. Some of them are even people that at one point or the other will tell themselves, never, I can never do substance. I can never smoke. I can never come down to that. Eh? Bible says we should be careful before, lest we fall as well. You understand? So there are people that it wasn't like outrightly they started like, no, my future ambition is just to smoke and you understand, and just smoke my life away. Nobody, if you probe, they may tell you, I say, no, now, there's no big deal in it. But if you find time, down to their level, compassionate, empathic, and you ask, you will find out that these are also individuals with dreams and ambition and family. And if you even probe for that, they probably were at one point or the other asking God for rescue because they don't know how to get out. So this is why we have to stay informed, know what to do, to guide ourselves against being influenced and joining the team of drug abuse, and also to be able to save a soul. And I pray God helps us in Jesus' name. So So the person is socially withdrawn, neglecting other activities. The person is not going for classes, going for work. The person is not going for any apprenticeship or work. The business cannot really focus. The person, in fact, as the person is selling for business people, as the person is selling both the cost price and the profit, everything onto daru. It's just everything is just going to the substance. Anything the person is just picking it and all. So you find there and also physical signs of intoxication. You know now when people, for especially for alcohol, what's it called? For people that abuses alcohol, you find a person delirium tremors. The person is confused. The person that doesn't even know what they are doing. They don't recognize the place. They are confused. They're not oriented in time and place. They know themselves. They can probably recognize people because they're oriented in person but place. You find somebody sleeping, they wake up in gutter and all those things. And those were even mild ones. Talking about other ones, the person is psychosis. There was somebody that just took and was intoxicated and the person run out naked, imagine how the person will feel by the time he's walking down the street. You understand? You can imagine the consequence. Or the person is just hearing voices, or the person just feel high, and the person is standing on the probably two-story building, and the person just everywhere looks like a leveled ground. You can imagine what will happen at that time, because the person is functioning at another level. What the person is saying, you are not saying it. So it has a lot of effects. So you start saying, they make boasts, they might even tell their Oga that, who are you? You understand? You can imagine somebody slapping a boss. There was a young man that we're counseling together that we saw. Of course, the person has to be medicated as well because there were psychotic symptoms. Bright young man, architecture, doing very well because I saw one of his work. I'm even like, I'll come back for my doctor's 10% discount. So this person at a point, he kept taking it, kept using Colorados and all that, so he decided to take another of its molly. So please, when you hear molly, avoid, hashtag avoid, you understand? And then he just started misbehaving at work. He was just climbing the fence and all those things and just talking. And there's this boldness talking to your boss, your CEO. You understand? If not that, his work was really good at what you do. They will. That is operation. You understand? Sack letter immediately. You understand? But they actually called the parent and no, this boy needs to be rehabilitated. So we had to, you understand, treat and rehabilitate. After which was when we actually, what's it called, certified I can resume work. So those are part of the complications of acute intoxication and also general drug abuse. So what are the factors that predisposes us to substance of abuse? Peer. I'm starting with peer. Which page? I'm on slide 9. Okay. So peers, the influence of peers cannot be overemphasized. Peer pressure. I want to break it down. Now, the aim thing is better we stay informed. Even when you don't want to use cannabis, there are some individuals. Is it in the Bible that they say, "Aya omode we reduce"? I don't that popular. You understand? It is common that youngsters and all that want to explore. Dora the Explorer. They are just mischievous and all that among their clients. So what they do nowadays, they call for birthday party. They won't serve alcohol, they won't serve drinks and all. They will just order for cake and then they squishy and they start putting things inside and the person start misbehaving. So out of 10 or something, maybe one will misbehave or two or three. But what is the percent? What is the assurance that one will not be part of the person that will be affected? And another thing about mental health is in fact, in medicine, once once a once a previous history is always a risk factor. If somebody has had an issue before, it can predispose, because substance of abuse is also mental disorder. In fact, when we make a diagnosis of any substance of abuse and behavior, we say mental and behavioral disorder due to use of either alcohol or cannabinoid use, or depending on methamphetamine, depending on the substance the person abused, with or without psychotic symptoms, if depending on the presentation of an individual. So, and once there is a mental illness, it can predispose to the person to have any other mental illness because the brain is being affected. So the person can now in future have depression, schizophrenia, bipolar, delusional disorder, different types. So it's better to avoid it. So, and then I was talking about the peer pressure. So the peer pressure, you find out birthday cakes and all that. Some guys will say, don't worry, I cover my drinks and all that. So it's better to avoid. Of course, we'll do birthdays, we'll trust the Holy Spirit to discern, but once we have the knowledge, we are careful of what and what we hit. So you can't just say, the person is not just bad. When you know, you understand, you have to be sure of which gathering are we going to. I can go and greet somebody, it doesn't mean I have to hit. You can't force me to hit. You understand? If they call me for an event, as a medical doctor, you have to go to so many places. But I don't have to eat or anything there. You understand? Somebody might even, it's as bad as that. Somebody might be like, let's call the doctor, let's come and encourage us. And then they give you, do you understand? Of course, you understand. So I'm just saying that we have to be aware of what is going on in the environment so that we don't fall a prey. And I pray with God's leading and Holy Spirit discretion, we'll be able to avoid all these loopholes in Jesus' name. So, at birthdays, parties, hostels, shared apartments, you understand, there was a particular patient with discharge, and we're talking about, because when we discharge on the ward, we don't discharge immediately. After they achieve symptom resolution, then you ask them to come in for parole. They go for home visit 2, 3 times to check how the person is well adapted to the environment, well rested, then discharge to clinic, after which they can continue either studies or work. So the individuals were talking about, okay, going back, where do you live before? So we found out that the person he was cutting with, supposed uncle that he was living with, this person is actually abusing substance too. So there is no way. So one of the counsel we had to give the parents is that they have to find another accommodation for him. And then while he's accountable to us and he comes around, if he gets overwhelmed or he feels the desire, the urge is too much, our psychologists are there, even the doctors, we do psychotherapy, we do psychoeducation. You understand? We are actually very patient because we know that it can be very addictive, and the fight is always a fight of faith. We fight with all, the person has to fight with all the whole full armor, if I can put it like that. All right. So, other things that can predispose somebody to taking, abusing substance and so much involved in use of substance is relationships, parents, family, and even courtship. So you have people, some people cannot manage stress. And then it's not like we're insulting. Our threshold is different. It's more like pain. Some people can stand and say, just give me injection. They stand, they give, are you done? They move. Some people, they'll be like, please let me rest more. Let me make up my mind. And then, okay, hold on. Then they take their injection. Some of us, you understand, we have to lie down. They grab the leg, grabs because we don't want the needle to break. You understand? So it's showing that we have different threshold. In fact, the point when I tried to take samples during house job, once I tried 2, 3 times, I call another colleague because as I'm pricking the person, I'm already feeling the pain. You understand? So there are issues, there are what's it called, disputes, home environments. If we, in fact, okay, let me give you another example. Even though this is not a substance of abuse, it's a case of depression. So this individual, this female, she grew up in a family in which the mother, the natural by default, because something, a premorbid personality, the way the person has been living their life. This mother in particular, she is the insultive type. Anything like this, Ebony, she abuses her and all those things. So she say a lot of negative words that, unfortunately, my own patient took it personal. Every word she utters, she takes it. So she had to run away from Kano, ensure she gets an employment in Lagos to herself. But even there, because she's cultural, she's well-cultured lady too. So you can't break ties with family. So occasionally on phone calls and all those things too. Then the one that happened recently, I think 2 months before she came to my clinic, was she had this malaria, something like a malaria illness that probably was resistant, and then she wasn't getting well on time. So the usual way the mother speaks, she just said, why are you stressing everybody? If you want to die, just die and free us of all this, you understand? Another person will be like, it's your mommy now, she didn't mean it that way. But somebody that, you understand, this is not one-off thing. So for her, she was just like, in fact, there was a day she was begging, can you just help me? Let me just go. Let me just die. Nobody will miss me. Do you understand? That's the impact, what the impact of words. So imagine somebody that is going through that every day and all that. And then the person will just find, somebody will say, don't worry. You meet a peer and explain himself. And then they'll be like, it's not just himself. I'm using him. Nowadays, both male and female, initially they talk about alcohol tolerance for male to be 21 and 21 units, then for female 14. Everything has balanced though, both male and female. So the Lord will help us. We are still kept. No matter how bad it is, there will always be few that will not bow down to Baal, and God will preserve us in Jesus' name. Okay, so if that, in the scenario of the example I was given, if that lady had gone to a bad pair And then they advise us, don't worry, just forget about your problem. And the person takes it. The person will feel high. Permits me to say, the highest level of, what I call excitement, euphoria, that people feel, this, they used to think is between married couples, sexual experience. They're saying cannabis is even higher, according to study. So you can imagine if somebody has been always feeling down and all that, something is making the person feel happy and lighter. Of course, the person will keep venturing and all those things. So this brings us back to, it is important to make the home conducive. It is important to make, among siblings, there are some siblings that will just be saying, talking anyhow. You understand? So you want to like ensure we encourage one another. You have to, in fact, there was one of the teenagers there, although she's an adult now, that I was working with back home. And then she was not abusive, but she was always, that my little sister, the way she was talking to them, I'm like, I had to call her. Give it a matter of 5, 10 years. Everybody will be like adults. Like if they are not close to you now, by the time you need to correct them, they won't come to you. So you have to be their friend. Because personally, the person that they used to call in my house that, oh, Morela Agba, oh, Morela, is the one we are closest to now. The one that was the boss of the house. It's just, Ekpelema. Nobody, you understand? But you need to ensure that your loved ones, your friends, your siblings, they can approach you and talk to you. Because imagine if the home is not available, they will turn to an outsider to ask questions. And God help us. May they not receive a bad information or advice. So, talking about the mood, failure, loss, people, coping mechanisms are different. The way people respond to bereavement, to failure, nobody wants to fail, nobody wants it. But sometimes it is almost inevitable. I'm not saying we are going to fail. We call it failure, but sometimes it might be just to understand things and see things in different perspective. For instance, how do I put it now? When this king, I should have done my Bible study before coming. When there's the king that promised that it was going to rain, and then he had to go and pray and go back again, he would check the cloud was not raining again, and then he would go back and, you understand? So you can't call those attempts failure. So he will go back again and pray. And then it started raining, then he started running. I think it's Elijah, right? That he started running, and then of course, you understand? So the fact that something is not working at the moment, because in life, I'm also growing. I'm learning that there are some things we pick up on our way. But if we don't if we don't overcome that step, we cannot even see the bigger picture. So there will always be challenges. There are people that had better scores in JAMB. My JAMB was 190. My first JAMB was 190 something. Second JAMB was 200, and I did a biochemistry. Came back for medicine and all. So there are some, you understand, but some people score 300 and something. And then somehow, they don't know person, Uniloring or Unilag and all that, paparazzi. You understand? You expect the person, is it not jam? At that point, it's significant for the person. So that individual has to be drawn closer and encouraged. In fact, the best time, okay, not the best, but one of the times that I appreciated my parent the most was a time that I failed an exam, and I was expecting that, oh, the star child has let them down. So in fact, I was already trying to punish myself. You can imagine. With all the knowledge, I was trying to punish myself. Okay, I'm not going to go with the car. I'm going to do it. They're like, what is going on? You have been there. Take it to the mechanic, let them service it. We go on. You want them to be looking at you? Like, no. You go and face it. You understand? So imagine when the home is settled. You understand? And home should always be where we can always return to. So imagine if home is settled. You understand? I felt accepted. I was like, he just asked me, what do you want to do? That was my dad. I said, we can, whatever we start, we have to finish. We move. So we went back again and did well. Just check what is going on and all that. But imagine if the mental state at that time, I cannot even ascertain what went on. I just went, the world is crashing and all that. Because there was I think 2 years ago or 3 years ago, there was a military woman, I don't know which of the Air Force or whichever one, that they reported that she jumped off the Third Milan Bridge in the night, in the middle of the night. So we went to see a family friend, and then the elderly one was discussing with my dad, don't mind those women, just because of a failed engagement. The guy proposed publicly. You understand? The man proposed publicly, and then
called off their engagements, and so she just went in the middle of the night, called her Uber driver, thought that one thought they were going to the other way, probably stepped out to make a call or something. She just jumped. So she was like, this child said, not even think about the parent. It's just relationship, you understand? So they were all judgmental and all. So I'm like, ma, I understand you're talking from a parent's perspective. But one thing is that we have to check both ways. I'm not justifying what she did, but I have to like, okay, we don't even know the kind of family. We don't know the setting. We don't know if the ones that they've been saying, when are you going to get married? When are you going to, do you understand? Are you, I have a particular friend when we finished house job. I was thinking, okay, it was around October, so it was close to December. I wanted to travel home, so I didn't want to take any job. At the same time, I didn't want to feel irresponsible. So, but I didn't want a job because once I start a job in November, I can't go for leave and I won't be able to travel and all those things because you have to do calls on weekend, no Christmas, it will be rotated. So, and then she was like, she's taking a job, but what do I want to go home for? I said, me, I'm going no more. This is everybody will be around. No, I have to go. I'm their auntie, favorite aunt, so you have to represent. So she was like, no, even recently that our mommy, okay, she was like, our mommy called her. I think the lady's going to be 35 or 36. That the mommy, she's always calling that, oh, your cousin got married today. Oh, there's some suggestive phone calls, you understand? That cousin, you understand? So she's not even planning to, it's called control, avoid, you understand? Like, even when the call is ringing, mommy, even if you're not on call, I'm on call, oh. Fine, we're always on call, oh, don't mind us. But even when we're on call, we still find time to eat. We find time to use the toilet. We find time to sleep. On call, you cannot be on call 20. It's possible some nights are very busy, but there are some times that it's calm and all. You understand? Even if it's an hour or 30 minutes, depending, you should be able to get a rest. So the person start avoiding and all those things. So if you have a kind of home environment like that, it predisposes the individual to abusing any of the substance that we are discussing today. So low mood, failure, being able to handle losses. Some people, an individual might tragedy happens. You understand? People lose loved ones, child, accident, different things. In fact, while I was in pediatrics oncology posting during med school, and then back then in OAU, one of the parents was asking me. In fact, that was when I knew that I can't do pediatrics. He just stepped aside. Hey, Dr. Ayeni, because everybody's a doctor, either you're a student or not. They just say, Dr. Ayeni, please, what exactly is your son? You will see the concern. He said, we live in my house. I built the house, the water, I did borehole. We are eating the same food. Why is this 12-year-old the only person that had cancer? Was this something, you understand? So we have to sir, there are so many unexplained in medicine. It can be genetic mutation. It's beyond any, but do you understand? So there are so many issues. So imagine, and we know cancer prognosis is bad. They talk about 5 years survival and all those things. So a lot of things happen. So imagine somebody, I had another, because as a doctor, now everybody will ask you for advice. So we tend to have a lot of stories around medical issues. So another friend was telling me that the mother had a chronic kidney disease in which she needed a transplant. So the son donated the kidney, and barely a year after, she died. Do you understand? So imagine how the person will be feeling. You understand? So if the person now have friends that will just say, don't worry. You understand? So that's why we thank God for churches, you understand, thank God for fellowship, brethren that you can account to and say, this is how I'm feeling. Some people are even angry at God, you understand? Because they prayed, they fasted, you understand? So they need to be able to find a place where they can call them and say, and discuss and say, this is what I'm going through, this is how I feel. Then we gently talk to them and help them to come back to Christ, and then help them to see things, even if it's for them to listen and say, let's take it one step at a time. Let's find out, you understand? And help them to see it in another dimension. Because you can see a glass half filled, and you can also see it as half empty. So it depends on our perspective. So I pray God helps us in Jesus' name. So other things I mentioned was unemployment, idleness. And an idle hand is a devil's workshop. when you see people gathering, even the Bible says that it's good for a young man to bear his yoke while he's young. So you can't wake up every day, you don't have anything you are doing, you are just, you understand. That's when we say, let's go there. You start seeing people and just share now, just take a puff. So by the time you ask, when we ask, take history of substance abuse, we ask, when was the first time you just, yeah, I just took a small puff from my shared with somebody. Nobody actually outrightly just go and buy one wrapper and say they want to take. There's always somebody else showed them at a point. They just took it and they feel, this is not bad. And then if find out they keep going back. Or when they are having issues, they remember, there was a time that I actually felt, let me just take it again. And then, as long as the problem is there, the possibility that the person will continue is there. And then, of course, the complication that may arise, which is always often than none. So complications of substance abuse. So there are complications which I've been mentioning along my presentation as well. So I grouped it, this is slide 11. So I grouped it in physical, emotional, social, family, and occupation. So the physical aspect, we talked about the neglect of self-care. So we call it complication under, okay, all right. So complication under personal functioning. So the person is not taking care of themselves, eating. In fact, another thing that is common with cannabis and all those sweets is that they don't even feel hungry. So if you're the person, you think the person has a chronic illness, they are cachectic, they are a drastic loss of weight. You understand? Because the person is not eating or not taking care of themselves. Emotional complications, you understand? The person cannot hold relationship. They can't focus. In fact, there was a couple that we managed. The man is already satisfied with what he's taking. So it was affecting their relationship. You understand? They don't have time for any other thing. They take it, they smoke it, they sleep off. They don't have interest. They cannot be empathic. They cannot relate because they're already having pleasures other places. So it will affect relationship. Probably a child that calls home every 2 days or every day. The person cannot even, okay, mommy, you are the one checking. The person is not even remembering to check home. So you have complications, you understand? That's the family emotional aspect. You understand? The relationship is affected. Then the social. People drinks and all, you say drunk drivers are the dangerous one. Ordinary person that is going on the way, the person that is drunk will drive and then you go and crash into another person, costing another life, affecting another family, probably predisposing those family again into something else because of the loss of a loved ones. So the cycle keeps continuing like that. Those are the examples of the social complication. Talked about the family complication. For every patient, and which is why I tell some of my patients that they'll be like, hi, I don't know why mommy and daddy is just forcing me here. They're coming, I'm using this drug for them. I tell them it's not easy. People come to, I think the only place that people like to come to in the hospital, when they will tell you proudly, that I'm going to the hospital, is O&G. That's where most of our doctors are, and they are very rich. Okay, I didn't say that too. So you see their accounts because they are happy. They give birth to babies. Doctor, thank you. Even we students, we collect because they are in happy mood. Babies, you understand? Our hospital won't be more, that kind of thing. But nobody will say, one try that. Do you understand? So I tell the person that even the weight, you understand, there's what they call self-stigma. There's another one, family stigma. Nobody wants to say, no, in our house we have a mental illness. Do you understand? So it's a burden on the family. For every child that they give birth to, the family already, like, I want this child to be, everybody wants their child to be good and all that, to turn out, to achieve their goals and dreams. And by the time they are not doing so, the person is gone in and out of the hospital, taking substance again, definitely the burden of care. And even the complications on the health and all that, everything is costly. Full blood count, ordinary blood test, MRIs in thousands of nairas, you understand? Brain scan, so many things, is really costly. Aside from the emotional burden on the family. Because, and the sad part is that while the person is symptomatic, the person is not even caring. The person is just enjoying the voices they are hearing. Everybody is hearing probably the sound of my voice from the microphone. The other one, him alone or her, she alone. She's enjoying the voices telling her, you are the president of the country. Some people will tell you, I'm Jesus. No, I'm not, I'm Jesus myself. God, you understand, you start saying, they call it delusions. You understand? So those are the complications. Occupation-wise, it might lead to loss of occupation if the person is not functioning, like the example I gave too. So I have a picture of It can also lead to suicide. You have people that will take, that will overdose on cocaine, they OD, they call it OD. OD is overdose, they overdose, and the person, a lot of even celebrities die from overdose of cocaine and so many things. And they didn't start, it wasn't that they just said, I want to die. No, they just keep taking it, and then because of the increased urge and compulsion, they keep taking it to the point that they take so much that the person respiratory is being compromised. So escape routes. I actually thought I would be done in 10 minutes. I didn't know that my talk would be a lot, but I hope I'm carrying us along. All right, so escape routes, because it's not enough. There is no health if we are talking about the problem and magnifying it alone. We must provide possible or probable solutions. So, looking at it, drug education, which is what I'm talking about, being enlightened, so that it's not like we are not aware. So we are sensitizing it, talking about substance abuse, the effect, how dangerous it is, as simple as it looks, and all that. What about the bus driver? They are doing well and all that. You don't really know how well they are doing, and God help us. In fact, sometimes I'll be like, hey, it's God that is protecting us. And one of my consultants will say, all of you that are taking, you understand, we can't help it. Some of us still have to use. So they are taking public transport. You don't know when somebody is high enough and the person will probably, God forbid, you understand. So those are the routes for escape. We need to know about it, learn about it, to reinforce our resolve so that we will not take the substance of abuse. And so psychotherapy, in psychotherapy, peradventure somebody has started taking the drug, we treat if there is any psychotic symptoms, if person is hearing voices, delusional, anything, erratic behavior, undue irritability. You see patient that slaps father. I say, why do you slap me? And slapped him again. Do you understand? Something that you know. And they will tell you, this boy ordinary or this lady is ordinarily gentle. You understand? This one is very quiet. The person beats the brother with belt, iron belt, with marks. So by the time the person is in, we have to do family orientation, what's it called, psychotherapy. And started saying, okay, it's an illness, educate them. I see your brother, I see your son, you understand, he was under the influence of substance abuse, so you have to rehabilitate back. So we do motivational interview for them to help them. Those are done in stepwise sessions, so I won't bore us with it. We'll ensure the person, to help the person have insight so that they can reinforce the, the decision not to take the substance again. Interpersonal relationship, we want to meet your patient one-on-one, group therapy, just to also encourage one another so that they can know, they can share life experiences and all that. Some people will be like, my own is not as bad as this, so then I better not I better stop now so that it doesn't become worse. So group therapy, counseling session, also rules and regulations. Some, for instance, is paramount among teenagers now. There was, I think, was it GSS2 student that one of them took substance to school, shared it and all that. Pediatrics will always invite us with consult to come and see. So you find all those things. So you want to put in place, you want to tell them, put them in check. Even for us, when you come for follow-up clinic, we do random toxicology screening and all those things. So social interventions, group culture, skills training and retraining, patient governance, spiritual therapy, very important. We cannot be underestimated. It helps a lot. In fact, one of my consultants in school used to joke that it's either two-way things. Either you know God very well or you have spiritual, you are into diabolic means, so that to reinforce you, because there are a lot of things that can be very, in medicine especially. So I mentioned Prochaska stages of change. It's just for education. Talks about when you see somebody that is ready to change. And one thing about people that take substance abuse is that they lie a lot. In fact, when they lie, you might develop what we call shared delusion, in which the person is, of course, the person is saying something that is wrong, false belief. You will believe it and you will share in it because I'm serious, or they will say it so well aligned. So you want to be sure that if you are, for instance, if you are mentoring or encouraging a friend, it just tells you how the person is serious about the change that the person wants to make. So pre-contemplation, the person is not so sure, doesn't see a problem in it. Somebody was telling me, I know also just smoke now. Also, but I don't think smoking is an idea, is bad. I think what happened, why I misbehaved was because I took a high dose, and this person climbed the, what's it called, the car top, and jumped to, you understand? He jumped on the fence from it. They had to grab, do you understand? Imagine if he had four. You understand? We'll talk about orthopedics and all these things, and orthopedic surgery and all realignment of bones are the worst. They have crucial pain, extreme pain, and with the risk of probably breaking any other bones or even affecting the spinal cord, which can even render the person bedridden or whichever for life, God forbid. Contemplation is when the person starts considering, it's true, I can really do without this. When the person weighs the pros and cons, that okay, these are the positive things. What is this drug giving to me? What is it doing for me? Probably it's giving me boldness, helping me forgetting. But is it really helping the person forgetting, or is giving a temporary amnesia? The person is not thinking at the moment. When the effect wears off, the person remember all the problems again, and of course the person will take it, and then the person consider what is the disadvantage to. You understand? Like the patient I said that recently that I saw with pentacocin addiction, we had to spell it. She's young, adolescent, so I had to spell it, paint the picture. That I've seen no one, not two. And then the way her eyes was, the pupils were dilating, I know that she was getting the memo. But it's not just about getting the memo. The person needs to be encouraged and counseled, because it is not an easy work, because it is beyond them. Some neurotransmitter in the brain has been altered, and which is why sometimes we give medications just to, correct what is being done. So the decision stage, the action stage, maintenance stage, and there's a stage for relapse as well. So rehabilitation, I talked about it. Precipitant for relapse, we've talked about it. Emotions, anger, depression, interpersonal conflict, social pressures, specific drug cues. Somebody decided I'm not going to do it again, and then there are people smoking around. I mentioned it in the course of my presentation: unemployment, financial issue, then stages of relapse. The person is already has made up his mind not to take any of the substance of abuse, cigarettes, smoke, and alcohol, cannabis, methamphetamine, any of the type, and then the person sleep. So you grab the person. So we must know where we are, so that we grab the person and say, help the person not to go back again before the person reach a full relapse, and then the cycles continues. But by and large, it's a very difficult thing. The best thing is not to start it. The prognosis is always poor, but never say never. If somebody has started, the person can change with the help of necessary help and intervention. In conclusion, it is always better not to start the misuse of drug, or to avoid misuse of any drug, to avoid the almost irrevocable damage to the brain, as well as the deleterious impact on the health in home. However, once the deed is done, this behavior should be curtailed, and its associated complications should be promptly managed, after which the wellness can be restored. Thank you so much.
Thank you very much. Let's do that to the glory of God. The time seems so short, but I think I enjoyed the session. We're just going to take one or two questions.